We work hand in hand with Cook Children's on that to get those kids into care at Cook. The other thing we don't do is burns. We've got one of the best burn centers just 15 miles away from here over at Parkland. So that is not one of the service lines that we chose to duplicate. So anybody that has more than 20% of their body with burns, they will go to Parkland because they know what they're doing over there.
It's always a communications problem for the word to get out.
It's a challenge.
In a timely manner.
It's a challenge. It's particularly a challenge in an environment where you are fighting, your message is fighting so much else that's out there. Right. You know, the world of digital media, and we all live in silos now. We're not all reading that same paper that used to come to our yard. So it's very bifurcated. It's very difficult to reach, to be able to get messages out. It is a challenge, for sure. So I'll wrap this up by saying the Blue Ribbon Committee made some suggestions after they did their year-long study. One of them is that we need a new inpatient tower on the main campus on the same side of the street as the existing patient care pavilion. Our old tower that was built in 1971, most of them are semi-private rooms, which is not an industry standard anymore for a number of reasons. It's an infection control issue, and it's very hard to comply with HIPAA when you're talking to one patient and the only thing that's separating you from the other is a curtain. It's really difficult to do that. So their recommendation was a new patient tower. They have also recommended a new behavioral health hospital that will be inclusive of both the medical and the mental health, emergency and inpatient. So we no longer would have to be moving people inefficiently and not safely across a campus. They recommended a new cancer center. The building that we are in now was not built originally as for cancer care. We have wonderful, loving, great caregivers at our cancer center who are working in an inadequate facility at this time. The other thing they suggested is our outpatient surgical center is here in Arlington. It's on the south of I-20 in New York. Right. Less than 25% of the patients who get surgery there actually come from Arlington. The majority of them are from Fort Worth. And they're coming over here to get their surgeries. And for the surgeons who work there, less than 10% of them actually only work in Arlington. They work in Fort Worth as well. So that is inefficient. The other thing that we're doing is we're seeing the outpatient surgeries on the main campus are using our ORs that are used for everything else. And so those folks are getting their surgeries bumped and bumped and bumped every time you have a trauma. That takes precedent over whatever was on the schedule. And so it's not a very pleasant patient experience when that happens. And then we're also having to move inpatient surgeries to late at night in order to get everybody in. So our Board of Managers, with the grace of the Commissioners Court, have decided that we will have an ambulatory surgical center that's adjacent to the main hospital. So those ORs would be sort of contiguous to the ORs that we already have. And that you may have already driven by, and I don't know if the sign's up yet or not, but there's going to be a big for sale sign up on the Arlington property. And we are going to use the proceeds from that to help pay for the construction of the new ambulatory surgical center, so that would not have to be part of the bond. We will do this regardless of whether there is a bond or not, because we need it. We need new specialty clinics. What we have now they're very small. We've got an orthopedic clinic on the second floor. Who's the last people you want to have to navigate stairs and elevators? People with orthopedic issues. So this will take care of some of that as well. We'll get those. And then they also said that we need, based on the growth in the community, 4 or 5 additional patient-centered medical homes in the county within the next 10 years, just to accommodate the growth. The decision on whether there will or will not be a bond election is not something JPS makes. that will be done by the Commissioners Court. If and when they call it, they have a certain prescribed by the state as to how many days before the election you can call it and those types of things. We don't know what their wishes will be. We hear everything from this November to if not all the commissioners are going to vote for it, then we won't put it on the ballot. I don't know. Whatever they choose to do, we will continue to provide care for the residents of Tarrant County. About 70% of our patients have no reimbursement attached to them at all. They have no insurance, they have nothing. Some of them can self-pay, but not all of them can. So 40% of our budget does come from your property taxes, ad valorem taxes. 40% comes from people who do have insurance, and we think Medicaid and Medicare is insurance at JPS. Other hospitals think it's charity care. We really like patients that have Medicare and Medicaid. And through grants and some of the other efficiencies that we have, and then 20% of the budget comes from federal dollars that we have. So not every dime comes from your property taxes, although some people seem to think it does, but it does not. So what will happen this November? I don't know, but we will continue to stand on the shoulders of John Peter Smith in our more than century-long tradition of providing great quality care. I have to brag just a little bit because we found out this week that JPS Health Network has now, for the second year in a row, been named one of modern healthcare's best places to work in the United States.
Oh. That's great.
That is really great. And that has to do with employee engagement and the experience of working there. It's not an easy application to make, but we're pretty excited about that. So it wasn't just a fluke last year when it happened. And so
I think that comes from Robert Early down.
without a question.
Yeah, the CEO over there.
He's
attitude.
pretty phenomenal. He's incredibly humble and he's funny, but he's a visionary. He had no background in healthcare before he was named CEO. He spent 10 years in the Texas legislature back when he was just a boy. He was 23 years old when he got elected. He was the youngest person to ever be elected to the legislature. Served for 10